Hello everyone. Today we'll be talking about natriuretic peptides. So there are three types of natriuretic peptides: ANP, BNP, and CNP. So ANP means atrial natriuretic peptide, BNP means brain natriuretic peptide, and CNP means central nervous system natriuretic peptide. So atrial natriuretic peptide is mainly released from the atrium, and thus it is named as ANP. And initially, BNP was basically thought that it is released from the brain, and thus the name was given as brain natriuretic peptide. But later on, it was found that along with brain, the majority of this peptide is released from the cardiomyocytes and basically by ventricle, and then thus the name was changed from brain natriuretic peptide to B-type natriuretic peptide. CNP is another natriuretic peptide which is found more in the central nervous system and the peripheral tissues, and thus it is named as CNP, denotes central nervous system. So atrial natriuretic peptide and beta natriuretic peptides are secreted from the atria and ventricles respectively. So ANP signals in an endocrine and paracrine manner when its main role is to decrease the blood pressure and cardiac hypertrophy. BNP acts locally to reduce what is called as ventricular fibrosis. C-type natriuretic peptide primarily has a role in bone growth. So all this ANP, BNP, and CNP, they have their action through a natriuretic peptide receptors. So there are three types of natriuretic peptide receptors, that is natriuretic peptide receptor A, B, and C. So natriuretic peptide receptor A is basically used by ANP and BNP to mediate its action by activating the transmembrane guanylyl cyclase. So after activation of this enzyme, there is increased release of cyclic GMP, and this cyclic GMP is responsible for all the effects of the natriuretic peptides. C type of natriuretic peptide activates a related cyclase, natriuretic peptide receptor B. A third natriuretic peptide receptor, that is natriuretic peptide receptor C, clears natriuretic peptides from the circulation through receptor-mediated internalization and degradation. So this receptor is basically used for the clearance of the natriuretic peptides from the circulation. So ANP is a hormone which is secreted by the right atrium. The release of this hormone occurs basically in response to the stretch of the atrium from the hypervolemia as well as in response to hypertension. So there are majorly four actions of ANP and BNP. One is vasodilation, which leads to hypotension; natriuresis, that is increased excretion of the salt and sodium; diuresis, antifibrotic and antihypertrophic effects within the heart. So these are all the protective phenomena. ANP acts to increase the glomerular filtration rate within the kidney. It does that by dilating the afferent arterioles and constricts the efferent arterioles. ANP also inhibits sodium and water reabsorption at varying levels of the nephron. This combination, so because of this increased GFR, what happens is there is reduction in the secretion of renin, and there is decreased activation of the renin-angiotensin-aldosterone system, and thus there is more protective effect on the heart in patients with heart failure. Neprilysin is an enzyme which largely degrades the atrial natriuretic peptides, but also degrades the other natriuretic peptides. So neprilysin, if there are more levels of neprilysin, there will be more degradation of natriuretic peptides, and all these natriuretic peptides has beneficial effects. So if you give an neprilysin inhibitor, you can increase the levels of natriuretic peptides and will have more protective effect on the heart in the case of heart failure. So neprilysin inhibitors are used in the drugs called as ARNIs, that is angiotensin receptor neprilysin inhibitors. Next, what are the actions of natriuretic peptides? As we have already discussed, it causes vasodilation, natriuresis, and diuresis. Because of vasodilation, there is lowers the blood pressures. It also lowers the sympathetic tone and reduces the aldosterone levels. BNP, or called as brain type natriuretic peptide or B type natriuretic peptide, was originally discovered in porcine brain, where it is thought to be neurotransmitter, hence the original name of that. Subsequently, it was shown that 10 folds more abundant in heart than in the brain, and thus the name was changed to B type natriuretic peptide. So, majorly during the formation, it is formed as a progenitor called as in the cardiomyocyte as pre-pro-BNP, which is after translation, it gets converted to pro-BNP, and pro-BNP gets cleavage and forms the anti-pro-BNP and BNP. So, this BNP is the physiologically active hormone. So many a times we come to clinical practice where we have to differentiate what is anti-pro-BNP versus BNP, and when to use anti-pro-BNP and when to use BNP. So let's go through it one by one. So as already discussed, NT-proBNP and BNP are the products of the pro-BNP. So from the cardiomyocyte, pro-BNP is formed from the pre-proBNP. This pro-BNP then cleavage into NT-proBNP and BNP. So in general, NT-proBNP levels are 5 to 10 times higher when compared to the BNP. And second important thing is that the half-life of BNP is 20 minutes, whereas the half-life of NT-proBNP is 120 minutes. So thus, NT-proBNP level stays there for longer time in the blood, and BNC level stays only for a shorter period of time. So since it stays for only for shorter period of time, BNP, its levels are not very much predictable or maybe unreliable in sometimes in case of heart failure. And another important thing is to remember is that this BNP is metabolized or cleared by non-renal clearance receptors, also by renal excretion and also by neutral endopeptidases enzyme in the blood. So there are three ways of clearance of this BNP. However, NT-proBNP is cleared only by the renal excretion. So this is important to be noted that NT-proBNP is excreted only by the renal excretion only. So suppose now if you have a patient of chronic renal disease or chronic kidney disease patient or renal failure patient, so obviously since renal excretion is affected in this patient, NT-proBNP level will be falsely high. So NT-proBNP levels will be very much high in patients of CKD. So NT-proBNP levels are not reliable in this group of patients in kidney disease. So in kidney disease, you should use only BNP in case if you want to see it as a marker for heart failure. CNP was CNP. CNP was originally also found in the brain and subsequently was suggested to be present also within the heart. It was also detected in the human coronary arteries and in the peripheral circulation and endothelial cells of human veins and arteries of various. CNP lacks a significant natriuretic function and serves as a regulator of vascular tone base. So let's go to each what are actions of natriuretic peptide in left ventricular dysfunction. So during left ventricular dysfunction, there is stress and stretch of the ventricle, which lead to increased release of natriuretic peptides. And these natriuretic peptides levels is indicators of the severity of the congestive heart failure, as classified by the New York Heart Association criteria. Natriuretic peptide as a cardiac risk factors. So many times it has been seen that in case of coronary artery disease, generally we do is cardiac enzymes like CKMB and troponins, but both BNP and NT-proBNP are powerful independent prognostic indicators in stable coronary artery disease, also in the non-ST segment elevation patients. It helps. So the values of this, or if you do a sequential levels of BNP and NT-proBNP, if the levels keeps on increasing, that means the prognosis is going to be bad. So natriuretic peptide in pulmonary disease. So generally, many a times you come across a patient who may appear complaints of dyspnea, and this dyspnea is a common symptom of both cardiac as well as pulmonary, and sometimes it may be difficult to differentiate both of them. So if you do a rapid testing of BNP and NT-proBNP, and if the BNP and NT-proBNP levels are high, it will go more in favor of cardiac when compared to pulmonary. However, there are few pulmonary diseases where NT-proBNP and BNP levels can be high. For example, cor pulmonale, which is a condition of right heart failure, secondary to the any lung disease. So, because there is right heart failure and stretch of the right ventricle, the pro-BNP may and NT-proBNP may release into the circulation. Also, pulmonary embolism, when there is obstruction to the right ventricular outflow, more stress on the RV right ventricle, and leads to what is called as more increased BNP and NT-proBNP. However, the levels BNP levels in this are intermediate in range, generally in 100 to 500 picograms per ml, whereas in congestive heart failure it is much higher. Natriuretic peptide in renal diseases. So in patients with renal disease, renal function clearly influences the diagnostic performance of NT-proBNP. So NT-proBNP had more favorable discriminative values in patients with GFR. So NT-proBNP you can use only if the GFR is more than 90, and its value gets less when the GFR is less than 30. Because as I've already said, because NT-proBNP is majorly cleared by kidneys. So if your kidneys are not working properly, there is no clearance of NT-proBNP, and there will be falsely high NT-proBNP levels. Unlike NT-proBNP, BNP levels are relatively independent of GFR. Natriuretic peptide in case of subarachnoid hemorrhage or head trauma. The patient with subarachnoid hemorrhage show an increased urine output and urinary excretion of sodium as well as higher BNP levels. Because as I've already said, BNP means brain natriuretic peptide. So BNP is not only released from the heart, but is also released by the brain. So in any brain injury, there are high chances that BNP might get released, and so BNP levels will be high in these patients. Natriuretic peptide in hyperthyroidism. So there has been a very study which has shown that in patient with hyperthyroidism, there will be increase in levels of natriuretic peptides. And after, once you correct the hyperthyroidism, the natriuretic peptide levels will come to normal. So that's all about natriuretic peptides. Hope you have liked this video. If you have any queries, do text me in my comment box. If you want more video like this, do subscribe to my YouTube channel, Dr. Akif Baig. Thank you.